Hi, I am Dr.Deepa Shamej. I am an orthodontist at Oasis Dental Care, Chennai. Today we are going to discuss about the teeth straightening without braces. Many patients are asking me that is there any method to straighten the teeth without braces? Yes, of course, we have so many options. One of the best method is the clear aligner treatment. The other options are they can go for crown, veneers and all. But these are all some kind of invasive procedure. They have to reduce the size of the teeth and they have to place the artificial tooth on it. The natural way to treat that is using the clear aligner treatment. These clear aligners are customized invisible braces alternative to the traditional braces. You know, the traditional braces, the visibility will be there, and in clear aligners, it is apparently invisible. And the other advantage is the removable appliance. You can remove it off and you can have the food, everything you can have. But in braces, some food restrictions will be there. In aligners, there won't be any monthly visit. You can change the aligners by your own. Every 14 days, you can change you will be getting number of aligners and you can change the aligners. But in braces, you will be having a monthly visits also. The main advantage of clear aligner treatment is that we can see the result before starting the treatment. We will be giving you a simulation video so that you can also see the result before starting the treatment, and also the duration of the treatment also we can predict before starting the treatment. That is the main advantage of clear aligner treatment. And most of the patients are asking me that in all the cases we can go for the aligner treatment. My answer is no. In some cases with impaction, that is sometime our tooth is inside our bone, so we have to expose it and we have to bring it, so that the best option is braces only. And in some cases with severe skeletal deformities, we have to go for a surgical intervention. In all these cases, we cannot go for this aligner treatment. Aligner treatment can be done in spacing cases, crowding cases, overjet, overbite issues, crow's bite issues, and all we can treat with aligners. Next, we'll discuss about the procedure that has to be done for the clear aligner treatment. First thing is you have to consult with an orthodontist, and second, we'll take an intraoral scan. In that scan, we can get a simulated video. What is the final output? Everything you can visualize before starting the treatment. And then next procedure is the attachment IPR procedure. This is the first day of delivery of the implants. We will place small attachments on your teeth. This is to enhance the particular tooth movement. And IPR means interproximal reduction. In order to get some space, if case is too much crowded, we need to align the tooth, so that we require some space, so that we have to do the IPR procedure. Clear aligner treatment we can do after 12 years of age, and the adult patient also we can go for the clear aligner treatment. But we need to assess the bond quality, gum support, everything. If sufficient bond quality, sufficient gum support is there, we can go for it. In adult age also we can go for it. Next is the cost of the treatment. It will vary individual to individual. It depends on the severity of the malocclusion. It all depends on the duration of the treatment. Once you come to the clinic, and when I checked clinically only, we can tell the approximate duration and the approximate cost for the treatment. Thank you.